Can you give me the month and year that we are in right now?
12/20/22.
Okay, do you have any allergies or illnesses that I should know about?
I'm allergic to bananas and amoxicillin.
Okay, so those are your allergies. Okay, I'm going to give you a head to toe assessment. I'm going to start from your head. I'm going to work my way down.
Mm-hmm.
I'm going to first start with your vitals, okay?
Mm-hmm.
I'm going to give you 3 words right now, and I want you to give those words back to me later on if you can, okay?
No problem.
Pop, smoke, sing. Okay?
Mm-hmm.
I'm going to start with the vitals. Are you in any pain at all?
No.
Yeah, I'm there. 100/59 is your blood pressure. That's really low. Do you always run low?
Yes.
Okay, so that's normal. Okay, I'm going to check your O2. While that's running, I'm going to check your radio pulse, okay? Radio pulse is 86 and her oxygen was 99 on room air and her respirations was 16. Okay, now I'm gonna come over to you. I'm checking you over. Your skin looks intact. You're very neat. I'm gonna palpitate your head and check for any protrusions or abnormalities if that's okay. Okay.
Mm-hmm.
Patient has no protrusions, no abnormalities, no lesions, and no signs of infestation. She looks very neat and put together. I'm going to check her ears with my pen light. Ears are clean, intact. There's no open areas. There's no rashes, dry areas, or any lesions in the back of her ear. Do you wear glasses at all?
Mm-hmm.
Do you have any issues with hearing?
No.
Okay, so I'm gonna go now and I'm gonna check your eyes, okay? I want you to first do me a favor and cover up one eye. Okay, I'm happy to cover up the other one. Good job. Now I have this pen light in my hand. I'm gonna bring this pen light to you, okay? I want you to follow that pen light. Okay, good job. I'm gonna come to the side. Good job. I'm gonna have you follow this pen light in each direction that it goes, okay? Good job. Patients' eyes, patients' pupils are equal, round, reactive to light and accommodations. I'm gonna now look into your eyes and check your conjunctiva. conjunctiva is pink and moist, and sclera is white. I'm now going to have you hold your head up, and I'm going to check your nasal. Have you ever had any nasal issues? Okay. Nasal mucosa is pink and moist. It's not dry. There's no signs of any mucus, and her nasal septum is in place. I'm going to have you open your mouth now. I'm going to have you wiggle your tongue around for me, up, down, and side to side. Okay, patient can wiggle her tongue up and down, side to side without issues. Her mouth is moist, pink. Their teeth are all intact, and there's no signs of thrush or any abnormalities. I'm now going to have you smile. I'm going to have you raise your eyebrows, scrunch up your face, blow air in your cheeks, and let it out. So that's checking the patient's neuro, and everything seems to be intact. Everything is positive, okay? I'm going to place my hands on your shoulders, and I'm going to have you press up against my hands with your shoulders. Good job. Patient's shoulders are symmetrical. Face is symmetrical. There's no signs of facial droop. And I'm now going to check patient's skin. Patient's skin is intact. It still looks moist. There's no dryness. There's no lesions. There's no rashes. I'm going to check patient's skin turgor. I'm going to pinch you right here and let your skin go. Skin turgor is positive, and it bounced back with no issues. That gives me signs that the patient is very well dehydrated. I'm now going to check your range of motion of your upper arms, of your upper extremities. I'm going to have you hold your arms out, and I'm going to press down on your hands. I want you to press up on my hands as I'm pressing down, and we're going to see the resistance, okay? Pressing down. Good job. Turn over. Same thing. Okay. I'm going to have you pull me. Okay, now I'm going to push you. All right. Patient's upper range of motion is strong and equilaterally. I'm now going to have you raise your arms up in the air, one at a time. This arm up. Good job. Bring it back down. The other arm up and bring it back down. Good job. Range of motion, patient's bilateral arms is positive and intact. I am now going to check your breath sounds, okay? I'm going to use my stethoscope, and I'm going to check your breath sounds to make sure that everything is okay. Visually looking at you, I can see that your breathing is unlabored, and you're breathing normally without distress. You're going to feel me touch you with my stethoscope. I'm going to have you take a deep breath in about 6 times while I check your breathing. Good job. Okay, breath sounds anteriorly are good. There's no adventitious sounds. Everything is clear. I'm going to check her breath sounds from the back. Posteriorly. We're going to do the same thing. It's just going to be on your back side, okay? Breath sounds anteriorly are clear, and there's no signs of abnormal adventitious sounds as rhonchi, wheezing, and or crackles. I'm now gonna, while I'm on the back of you, I'm going to press my arms up against your back. I want you to sit firmly, and as I'm going down your back, I want you to say 99. Okay? Ready and go.
99, 99,
and that was positive also. Now I'm coming back around, and I'm gonna check you around here, around your diaphragm. Take a deep breath in for me, and let it out. Good job. So now I'm gonna have you hold your hands out, and I'm gonna have you take each hand and touch your thumb, and count down. Good job. And that's positive. Patient can touch her fingers, each finger positively, without any issues. I'm now going to have you lay down. And I'm going to check your abdomen. I'm first going to inspect your abdomen. And I can see that the patient's abdomen is non-distended, it's flat, there's no bulging, and the skin is intact. I'm next going to osculate your abdomen, so I'm going to listen to your bowel sounds with my stethoscope. Bowel sounds are present. Could you tell me the last time you had a bowel movement?
This morning.
Okay, you haven't had any issues with constipation, straining, or any of the above, emesis, abdominal pain?
No.
Okay. I'm now going to touch your abdomen. I'm going to touch around your abdomen to feel for anything abnormal. You let me know if that hurts you at all at any time. Okay, I've osculated and palpated the patient's abdomen, and I do not feel any hernia, any bulging, any distension, or any abnormalities. While I have you lying down, I'm going to come down to the bottom of your feet, and I'm going to check your capillary refills on the bottom of your feet, okay? And check for your dorsal pedal pulses. Capillaries on toes are less than 3 seconds. Dorsal pedal pulse is very light, but I can feel it, and it is bounding. Pulse is bounding behind ankle. I'm going to also do the same thing with your feet that we did with your hands. I'm going to have you press down on my hands. Okay, then I'm going to have you pull back. Good job. I'm now going to have you lift your one leg up, put it back down, lift the other leg up, put it back down. I'm going to have you extend your leg out. Good job. Extend your other leg out. Good job. Could you lift both legs at the same time off of the bed for 5 seconds? Good job. You can bring it back down. I'm checking the skin. The skin is intact. There's no dryness. There's no signs of any lesions, cuts, or anything. My patient's not diabetic, so I'm not in fear of any breakdown. She has no areas in her toes. Everything looks good. I'm gonna put her socks back on. Okay, if you could turn around and sit up on the side of the bed for me. Okay. While you're sitting up, I'm gonna now check your heart sounds, okay? I'm gonna check your heart sounds in 5 different areas. You could breathe normally while I'm doing this. Excuse me. I'm now going to check your heart sounds. I'm going to check your heart sounds with the bell of my things, of the bell of my stethoscope. It's going to be the same thing. I'm just hearing it from another way. I'm checking for heart murmurs and abnormalities. Everything sounds good. I am now going to check your apical pulse, and I'm going to listen to that for 60 seconds, okay? Apical pulse was 62. I'm now going to have you stand up for me, and I want to check your gait. So I'm going to have you walk normal, a few steps forward, and I'm going to have you walk back. I'm next going to have you walk one foot in front of the other. Good job. Patient's gait seems to be stable. I'm going to have you stand. Close your eyes.